Mówimy coraz więcej o wadze czasu w leczeniu SM. No właśnie, jakie on odgrywa znaczenie?
Well, in actual fact, that's a topic I will address in my talk. It's of utmost importance, I think. Now that we are able to make the diagnosis early on, in the absence of a curative therapy, there is the mandate really to prevent the ongoing inflammation, the destruction of the nervous tissue, and there are multiple lines of evidence to suggest that early initiation of therapy just produces the most benefit and is effective long term.
No właśnie, co jeżeli ta terapia rozpocznie się zbyt późno?
Well, there are a number of studies that clearly demonstrate delayed initiation of therapy is associated with a poorer outcome. So more disease activity, more relapses, more disability evolving over time.
Proszę powiedzieć, w Niemczech furaman dimetylu jest dostępny od 3 lat. Jakie pan profesor ma doświadczenie w leczeniu właśnie tym lekiem?
Well, it's been really sought after. People were longing to get on Tecfidera dimethyl fumarate because it's an oral drug. A precursor has been in use in Germany for another disease, psoriasis, for some 20 years. So there's an extensive background of experience, and it's been used mostly as a first-line drug. So in patients who've just been diagnosed. There are a couple of issues that can be minimized. They cannot completely be avoided. This is gastrointestinal problems. This is flushing. This is a little bit more of a sort of cosmetic problem, but otherwise, now with I guess some more than 240,000 patient years of experience globally, it's proven to be an effective and safe drug. And sort of intermediate, if there is very much disease activity and if the patient has not responded, there's always the escalation therapy, say with the monoclonal alemtuzumab, but that comes with a number of safety issues. So I think Tecfidera is a good, effective and safe therapy.
A jak się porównuje te starsze terapie do tych terapii nowoczesnych, co zyskuje pacjent?
Well, if you look at all the pivotal trial data of the old drugs, I mean those that were first used, the injectables, and take into account the way they are applied by injection, there are many patients who prefer the newer drugs that have shown, at least in pivotal trials, greater efficacy. Although some of this needs to be taken with a note of caution. But I think the good thing is there is now a whole panel of drugs from which the patient and the doctor can choose and to tailor a therapy to the patient's individual disease type, disease course, disease activity, risks in terms of prognosis, and willingness to accept ways of taking the drug, ways of monitoring, and risks. I mean, each and every drug that is effective has some side effects, and they obviously need to be taken into account. But overall, I think there is a clear positive and astonishingly positive evolution in clinical development of MS drugs. There is no other neurological disease where we have seen in the past years so much advances in terms of new drugs coming to our avail, and just the prognosis and what you can offer to the patient is now much better than it was 20 years ago.